Hi. If you are a woman in perimenopause or menopause and wondering why your health can be so wonky, like why are there so many different symptoms that you might be dealing with or deal with, there are a lot of different reasons for that. But of the reasons, there is a key factor. And this key factor is damn annoying. It is so annoying that if I had a magic wand, it's one of the things that I would poof away to help make the lives of and health of women in perimenopause and menopause better. And that is inflammation. Hi, my name is Danett Bean. I'm a doctor of Eastern medicine, specializes in women's health, and I'm here to talk to you today about why it is that inflammation can make it harder to heal during the time of perimenopause and menopause. So, inflammation by itself is not a bad thing. Our bodies are really smart, and when there's an issue, it's the body's response to handle things. But chronic inflammation can cause issues. So, when we talk about inflammation, these are pockets of heat that can arise and over time have more of a systemic effect. In fact, I believe there's some group, what are they? It's the Journal of Neuroinflammation, where they talk about perimenopause as a systemic inflammatory phase, right? And that it can later affect our neurological health, which we can go into in another video. But nevertheless, the main thing is inflammation is a pain in the you know what. And my perspective all comes from an Eastern medicine, traditional Eastern medicine perspective. So as we get older, so we have the yin and the yang. Many of us have seen that symbol where there's like the two fish that look together, the white fish on the top, the black fish on the bottom. And so the black fish on the bottom represents the yin. The yin and the top white represents the yang. And so the yin energy, which is the bottom at the black, um, is cooling. It has a lot of different correlations, but the yin energy is cooling, it's moistening, and it's calming. And as we get older, that yin energy decreases. And so when the yin energy decreases, what makes us cool, what makes us calm, what moistens us decreases. And so that can cause more heat. And from that heat, from an Eastern medicine standpoint, then that can cause more stagnation where the qi and blood isn't flowing as well, which is why one of the most important things that we can do during this time is to have a really good exercise regimen, like a really good regular thing, which God knows it can be so hard to do because then we may be getting pulled in lots of different directions because many of us who are in perimenopause and menopause are in what's called a sandwich generation, where maybe we're thinking of young children, maybe we have children, maybe and or we are caring for older adults as well. So all that to say that inflammation can arise more easily because of this decrease in yin. And I want to back up a little bit because it's not the exact same thing. So Eastern and Western, there's some overlap, but what I should say instead of inflammation when I'm talking about Eastern medicine is more so the decrease in these pockets of heat. We talk a lot about heat and how that can impact things. Western medicine, it's they note that these fluctuations that can happen when we're in perimenopause, in particular, these big fluctuations of estrogen and progesterone, and then the decline, all of this can activate the pathways of the inflammation. And so that's great, but what can we do about it? Well, let's back up some. So these pockets of heat that are not that are causing us to be imbalanced, this definitely can be a factor towards hot flashes. We talk about heat disturbing, we say in Eastern medicine, traditional Eastern medicine, as disturbing the sleep, the shen. We kind of need this dark, cool environment to be able to sleep, but sometimes if we are dealing with more of those heat signs, it's more difficult to be able to get rest. So when we talk about decreasing the heat that is, because we do need a certain balanced level of heat, but this is heat that has arisen because of the decrease in the cooling factor. Um, what we need to do is do things that help to promote more of this coolness and that are anti-inflammatory. So three things that you can do. Number one is have lots of greens and green foods. In Eastern medicine, we talk about how different colors have different qualities, and green is definitely more cooling. So when it's apple season, if you have the choice to choose between a green and a red apple, we would say in terms of Eastern nutrition that the green apple is cooler. So try to have things that are more green. So that's one. Having more green foods is very key. Okay, second, I mentioned before was the exercise, right? Getting to exercise helps a lot with getting our chi and blood to move more freely, and it is just something that's really helpful towards healing from inflammation and this excess and this additional heat that can be an issue during perimenopause. And then third is lots of omega 3s. Some of my favorites, it's like I didn't get to finish my meal here, but that's perfect. Flaxseed is really great. Thought I had this out of the bag. I'm not endorsing Trader Joe's, even though they're pretty cool. But I have some flaxseed here from Trader Joe's. But you can get flaxseed from anywhere, and I like putting it in my yogurt, and it's nice. And then also something else that's really loaded up with omega 3s that's really nice are walnuts. Yum yum. Actually, of nuts, walnuts were not my favorite, but they're so good for you. They're so good, and so many times I'll suggest them to patients, and they're like, I don't want that. And I'm like, well, it has a lot of benefits. Walnuts are actually also helpful for our kidney energy, which is a conversation for another time. But I will say that the kidney energy, not your kidneys itself, but your kidney energy plays a role in all of the different reproductive phases that we go through, both men and women. So walnuts are usually great, a great addition. But yes, so the three things are the green foods, the regular exercise, and omegas like the ground flaxseed and walnuts, which is um, are really helpful to the body. And I'm going to add in a fourth, a bonus one. If you want to do a deeper dive and significantly help to decrease inflammation, I have a program that I'm doing live that starts September 15th. If you are watching this video at a different time, after September 15th, you will still be able to do this program. But what's significant about the September 15th date is that I will be kicking it off live and I will be closing it live. And it's a really great chance. It's 10 days. And over the time period, there are certain herbs and shakes and specific foods that we'll be focusing on that really help to decrease inflammation. But what makes the difference in the program is the concentrated herbs that we'll be using. It's about 5 different supplements, and it's a really great protocol. I've used it over the years and have seen it work really well for a large variety of women. I think about one woman who is dealing with a lot of hormonal imbalances. She was also dealing with some autoimmune issues, and she was really having difficulty sleeping, and she wasn't feeling what was going on. I mean, who could blame her? And she did the 10-day protocol, the 10-day Out with Inflammation program, and she was in love. I have some patients who do it and they just want to keep doing it. But you don't need to keep doing it. We do it for 10 days, and then we talk at the end about what to keep for your new normal, for your healthy new normal. But yeah, and she got some of the best sleep that she had gotten. So it's a really great program. And so if you are interested, there is should be a link in the bio or description. So yeah, maybe I hope to see you then. Doors close on September 13th. So as always, it's a pleasure, and take good care of yourself. Love being a woman.